I think ketamine went from being a substance that was always administered by an anesthesiologist in a very medicalized setting to this medicine that is now, especially after the COVID situation and certain companies being able to ship ketamine at home and certain practitioners, we have more and more of it's being done remotely without direct supervision, and even some of them now offering mail-in injectable forms, which is a pretty interesting shift away from how it was. Perhaps it's a good time now to just delve a bit into the history of ketamine, just touching on some basic points of when it was first synthesized and used and how, and then we can talk about how it's evolved since.
Yeah, of course. So ketamine was first synthesized in 1963 by a University of Michigan researcher. It wasn't FDA approved for general anesthesia until 1970. And that's really, like we talked about, where it lived for the next 3 decades until the early 2000s. But lived in the anesthesia world for those reasons. It's a wonderful anesthetic, no decrease in respiratory drive, hemodynamically stable, safe in unstable patients, whether that's on the battlefield, whether that's in resource poor locations, whether that's with children without IV access. You can use this in a lot of different patients and use it safely and appropriately. And then also, aside from just being a safe general anesthetic, you could use it as an analgesic and a great treatment there. Then in early 2000s, we noticed that there's antidepressant activity to it. And those were really the first studies were like in the 2006, 2007 range. And that was the first time we really started to evaluate ketamine as an antidepressant. And it showed great data, and it continues to show really good data, but it's superior to SSRIs. Um, and it's not a once daily medication, but something that actually helps the patient heal themselves. And I can't wait to dive into that a little bit more with you. But it's it's been great as an antidepressant. I think its rapid effects great for anti-suicidality and acute management of that. It also, I think you're talking about, is gaining some popularity for analgesia as well, and I think that is a very underutilized indication currently. I think that there's huge opportunity for ketamine with analgesia and with chronic pain patients for a couple reasons. One, it's like I said, I'm an anesthesiologist. I was trained to attack physical pain, right? I know some awesome. I learned from some great physicians that are very creative on how to use procedures and different combinations of medications to produce profound analgesia, right? And I'm extremely grateful for that training that I got at the University of Colorado. But we're using ketamine very unidimensional, and there's always was a subset of patients that our medicines weren't working for. We can get them an epidural that everything's numb. We can do a nerve block. They can't feel their leg, but they're still telling us they're in 10 out of 10 pain. And at that point, either my attendings or they would kind of just put up their arms and point to their head and say, it's supratentorial. I mean, what are we going to do? And that always really bothered me, right? I mean, we're pain physicians, right? I mean, they're in pain. I don't care how they're in pain or why they're in pain, but they're in pain. I mean, how do we help them? How do we use the tools that we have to fix that or to improve on that or help them improve themselves? And I think that's really where ketamine can come into play. And that's is brings up this concept of total pain and that you guys are experts for in palliative care. And I'd love to hear your input as well. But like I didn't learn about total pain until I started doing my own independent research. And I think Dr. Fracken's on here. He was actually the one that introduced me to this concept. And honestly, it changed my life. And I'll be forever grateful for him because to him for that because it changed the way I think about pain. I've always known that there's a psychological component to it, but I've never had such a good concept. And total pain is this concept that was created by Dame Cicely Saunders is the in the 60s, who's a wonderful story herself, but she started the first hospice in the modern hospice of what we know today in London, England. And she described pain as this total pain concept. Yes, there's physical pain. Again, that's my expertise. But there's also psychological pain there's social pain, and there's spiritual pain. So there's four components of pain that everybody that's experiencing pain has some mixture combination of that. Some are heavily weighted in other areas, but those are all contributing to the patient's subjective experience of pain. Ketamine has the unique ability to attack each of these four segments of pain, and that is, to me, is just like, wow, this is the answer, right? Because you could attack physical pain. I'll go through the mechanisms with you in a bit. It attacks the psychological pain. Again, we're going to talk about that in the pain. But once you can fix that physical and psychological pain, you could really improve upon your social pain. You could really make those connections with your family, with yourself, with your environment that you haven't been able to really have because you've been so focused on your pain. You could, and then ketamine, like we talked about, as a psychedelic in this deeper experience can be very spiritual and can absolutely help heal that spiritual pain. So with one medication at different doses and in different regimens and in different settings, we can attack all four of these. And so it's up to the clinician to see which one we want to go after and the patient, right? Working as a team, talking to the patient, working with their therapist, seeing as a team, how do we each play a role in healing this patient? You know, is it the anesthesiologist is going to figure out the dose of the regimen, while the psychiatrist is going to help figure out what is really bothering the patient, working with the patient, and all together we come up with a plan to attack the total pain. And I think that is a very huge opportunity for utilizing ketamine in this space.